Hello and welcome to the question of the day. We really have a very interesting case today. So we have a 65-year-old male who's brought to the physician after he complains of unsteady gait, um, lightning type of back pain, which means they are very sharp pains in the back, and urinary incontinence. So all these signs are related to the neurologic system. He has been a habitual drinker and smoker for over 25 years. Now, clinical examination reveals and confirms that he does have an ataxic gait. A positive Romberg sign. Now, what's a positive Romberg sign? The the patient who is brought in is made to stand up. And if you want to test his sense of proprioception, or what is called as the sense of joint position, then you perform this test. Patient is made to stand up and close his eyes. If he remains steady when his eyes are closed, then the sign is negative. If the person becomes unsteady or falls down, then it's a positive Romberg sign, indicating that his sense of proprioception is impaired, which means his sense of joint perception is impaired. Now, this happens when the dorsal column is affected or degenerated. The dorsal column is also called as the posterior column of the spinal cord. The second important neurologic reflex that is tested here is the light reflex. And the patient in this case has an impaired light reflex as well. Now, there are two reflexes that are paramount. One is the light reflex, the other one is the accommodation reflex. The accommodation reflex has not been mentioned, which means that it seems to be normal. Now, when we say that the light reflex is impaired, it means that when you shine a, a torch light into the eyes of the patient, then his pupils fail to constrict, while as the accommodation reflex is normal. So this classic situation where light reflex is impaired but accommodation is normal is what we call as the Ergile-Robertson pupil, which is pathognomonic of tertiary syphilis. Now, this is how you're supposed to analyze this question and come to a particular diagnosis. Now, this becomes very easy to diagnose now. Moving on, the lab and radiologic tests, a diagnosis is made and treatment is initiated. But despite the treatment, the patient succumbs and dies within 2 weeks. A clinical autopsy is performed. A horizontal section of the lumbar cord is shown here. So what is the most likely diagnosis? We have 5 options: vitamin E deficiency, B12 deficiency, multiple sclerosis, a spinal cord tumor compression, or Tabes dorsalis. Now, it's very easy for you to diagnose this now. It is Tabes dorsalis, and Tabes dorsalis shows degeneration of the dorsal column. I have marked the dorsal column here, and this is completely degeneration. You can see a tinctorial difference. This is pretty dark. This has lost all the color. So this is Tabes dorsalis. The closest option here was B12 deficiency. Had it been B12 deficiency, then it would have affected the lateral columns as well. So what we call as subacute combined degeneration would be a degeneration of the dorsal as well as the lateral columns. So this would have also shown degeneration on both sides. So that is not the case here. These lateral columns seem to be normal. It's only the dorsal column which is impacted. Now, all these 5 can cause similar findings. So they are the differential diagnosis. But look at what is happening in the case of Tabes dorsalis. I told you that the Erkile-Robertson pupils exist. The patient has unsteady gait, a positive Romberg sign, ataxic gait, proprioception is gone, sensory ataxia exists, impaired sensations and lightning pains in the back. So all these you should be able to pick up very easily and suspect a Tabes dorsalis, which can, of course, be confirmed very easily with an FDA ABS test. If you look at the other examples, the other differential diagnoses, they're all pretty much there, but not quite as strong, except in the case of B12, the sense of proprioception is impacted. But you can never be sure about the other reflexes. So you should not have any difficulty in diagnosing a tabes dorsalis. More importantly, I wanted to understand the methodology and the systematic approach to your clinical reasoning when you solve such questions. So thanks for watching, and I'll see you next time.